Now I wanted to show you how to document telephone calls and lab letters. So you've received your patient's labs and potentially imaging, and you have to make a determination, am I going to call the patient or am I going to send them a letter? It's a judgment call, but in general, my practice and most physicians' practices are if the labs are, essentially normal or unchanged from their baseline, a letter to the patient is appropriate. If there is anything that's newly abnormal, I think a phone call is appropriate. And these are just general rules. For instance, I have a few anxious patients who um, really require a phone call for all of their labs because I know that a lab letter would not be, sufficient even if the labs are normal. So these are general rules. But let's assume that your patient's labs are all normal, and the patient has said, just send me a letter if they're normal. So how will you send them a letter? You'll go up here to the visit type. You'll click on this. You'll go to new visit and you will type in WX Administrative Clinic. This will allow the letter to not be coded. It will not show up for workload credit. The patient will obviously not be billed. So you'll click WX Administrative Clinic. You'll change the date time to right now, and you'll click OK. You'll know you did it correctly if it showed up here as WAC. If you're a JP resident, you can use this as well, but I guess you can also use JP Administrative Clinic there, and that would show up as back. Interesting. Okay, you'll go to, so now that you've changed it to the administrative code, you will go to New Note, and this is where you will go to Patient Results Letter, and you will click OK. It'll take a minute to spin, and this will pull up a template. So you will start clicking the boxes. So by clicking these boxes, it will add letterhead to it. So if you're a West Roxbury resident, you would click here, JP here. So when you click West Roxbury, and then you click this box, this will add the letterhead to your note. And this is preset. And what you can do is you can add your patient's labs in here. So let's say I did a CBC, let's say I did electrolytes, and I did blood sugar, and I did kidney function. So this will all add these to the note. Now, if you did some more, esoteric testing, you may have to manually enter that because these are just the basic ones. There are some preset messages here which you can use. I find them to be a little bit impersonal, so I don't use them, but if you want to, you can. And then at the bottom, I always click this box that says, if you have any questions, and then in the sincerely, I will type in my name here. And you will hit OK, and you can see that this populates this into a letter. Generally, what I do is I make a few edits at this point. I say, Dear Mr. ZZ Mouse, or if you guys are on a first name basis, you might say, Dear Bashful. Okay. And I delete this because this is generic, and this is probably overkill, but I consider this to be sort of the art of medicine. And I say, Dear Bashful, it was great to see you last week. Just wanted to let you know that all your lab work looked great. Have a wonderful summer. So if that's your style, great. If it's not, you can leave the generic things. Then you can see that all of their lab results will be here, and then your name will be signed at the bottom. So if this is satisfactory, you can right-click and do Sign Note Now. Now, if you're in clinic, you can certainly print the note yourself, sign it, and put it in. There's a box behind the front desk where they will mail the letter. But let's say you're working remotely, which many times you will be. How do you make sure the letter gets mailed? That's where your medical support assistant comes into play. So at the beginning of the clinic, when you're an intern, you will learn who your MSA is. And what you will do is, once the letter is signed, you will right-click on the letter, do identify additional signers. And my MSA is Aileen Nascimento. So I would type her name in here, click add, and then hit OK, and now this note will be routed to Aileen. Aileen knows that when I route this note to her, as well as any resident lab letters, she will just automatically print that and mail it out to your patient. So that is how to do lab letters.